Hi, I'm Tracy Hubbell, Senior Product Specialist with Stella Life and longtime hygienist. Thank you for your time today and joining. I'm looking forward to sharing more with you about Stella Life Dentamedica, so let's get started. We'll cover why Stella Life, what is Stella Life Dentamedica, the science behind it, and the whys, as well as incorporating Stella Life Dentamedica into your practice. Our mission is to improve lives with accelerated healing, relieving pain, and reducing the need for opioids. We work with thousands of dental and medical practices with hundreds of thousands of satisfied customers. Those satisfied customers reflect in our Trustpilot score, which we take great pride in. We have an award-winning product line. Our Stella Life Oral Care Recovery Kit has received the Top Healing Award from Dental Advisor for the last 7 consecutive years. Our Oral and Gut Probiotics Kit was named one of the top 5 take-home products. We also work with many different continuums, implant institutes, and work closely with many study clubs, both doctor and hygiene clubs, and attend many conventions and meetings across the country where we're able to share more with you and learn more about the important work that you do every day. Stella Life Dentamedica is a comprehensive dental recovery support program to promote the body's healing process both before and after surgery or procedure. It's designed to supply the essential nutritional supplements to boost both vitamin and antioxidant levels. It's also a great multivitamin. Vitamin D, as we all know, is the vitamin for bone. It absorbs calcium. It may also play a role in muscle function and the immune system. Some research also indicates it helps in the prevention and treatment of diabetes, heart disease, high blood pressure, multiple sclerosis, and more. While the importance of vitamin D to overall oral health has been well established, we continue to learn more about the impact of vitamin D deficiency. Vitamin D deficiency is becoming more and more frequently associated with early implant failures and dental complications. There's a lot of information in regards to Americans with vitamin D insufficiencies and vitamin D deficiencies, ranging anywhere from 50% to 70%. To put that in perspective, that's every 5 to 7 people out of every 10 that walk into your office that are deficient in their vitamin D levels. Here's just a few of many informative articles and research done by Dr. Rick Myron, Dr. Michael Picos, Dr. Nate Estrin, and Dr. Scott Frown, and others. The QR codes will readily take you to these studies. Additionally, we have more research and information available for you at stellalife.com under our Research tab. This study shows the impact of using Dentamedica. All in this group were found to be at some level of vitamin D deficiency. Following the 4 to 6 week supplementation, every patient reached sufficient vitamin D levels and antioxidant scores. Antioxidants play a crucial role in healing and maintaining overall health. They protect the body from oxidative stress caused by free radicals. By neutralizing the free radicals, the antioxidants promote faster wound healing. Stella Life Dentamedica speeds up the healing process by boosting important nutrients before and after surgery. There are remarkable benefits and properties for maintaining periodontal health, bone physiology, and soft tissue wound healing. It's rich in essential vitamins such as D, K, A, B complexes, and more. The benefits are numerous, from healthy bone and soft tissue, immune system health, energy levels, reduced oxidative stress, and collagen formation. Dentamedica is made in the U.S., it's non-GMO, and made in a GMP facility. GMP stands for Good Manufacturing Practices. What that means for you is that the strictest regulations and guidelines are adhered to ensure the highest and safest quality and effective products. It's also vegan and gluten-free. We take pride in providing a very clean product with the best possible bioavailability. Here's some examples. We're vegan as our D3 is sourced from lichen, which is plant-based. Our K2 is derived from chickpeas rather than soybeans, therefore making it soy-free for those who have those sensitivities. The B9 MTHF is methylfolate. B9 methylfolate is naturally occurring and better absorbed, whereas folic acid is a synthetic form of B9. Many have difficulty metabolizing folic acid, which makes the methylfolate a better source. Dentamedica does not have magnesium stearate. Magnesium stearate is commonly used, which can cause digestive and upset irritability. I just spoke with someone who had been taking Dentamedica, and I believe she was maybe a bit skeptical at first because of her past experiences with multivitamins. She was very excited to share that this is the first multivitamin in her lifetime that she's been able to take without experiencing an upset stomach and nausea feeling. B12 methylcobalamin is the most beneficial form of B12, as it's also naturally occurring and most easily absorbed by the body. Also, the calcium is calcium citrate, as it's more easily absorbed than calcium. Dentamedica is ideal for patients undergoing dental surgeries such as implants, bone grafting, soft tissue grafting, and other therapies requiring healing. Vitamin D levels can be measured in office with a finger prick procedure or a blood draw. To take daily as a supplement, simply take at half dosage. Many practices incorporate Dentamedica into their surgical procedures treatment plans and their periotherapy protocols. When using Dentamedica, discontinue using any other multivitamin supplements. Please remain taking any prescription medications, and you can remain taking probiotics. However, again, discontinue use of any other multivitamin supplements. You would begin taking 4 weeks prior to surgery and 2 weeks post-surgery. You'd take 2 capsules in the morning with breakfast or lunch and 2 capsules in the evening with dinner or before bedtime. This is considered your loading dose to help boost the antioxidant and vitamin D levels. Dependent upon a patient's extent of their surgery, their current vitamin or antioxidant levels, and or their general overall health, you may make the determination that they would need to take Dentamedica 8 weeks prior to surgery and 4 weeks post for their healing. Thank you for learning more about Stella Life Dentamedica and how it can impact your practice and patients. Connect with us for a team learning about Dentamedica and or any of our wound healing products.